thigh region. Okay, here's the anterior compartment, medial compartment, posterior compartment. The anterior compartment consists of two muscles. Yes, this is the sartorius muscle, strap muscle, parallel fibers. Okay, originate from ASIS, anterior superior iliac, spine to SGS, upper medial of shaft of tibia. Okay, now the other muscle is the quadriceps femoris muscle, which has 4 heads. This is the rectus femoris. Rectus femoris, straight head. Rectus means straight, straight head. Rectus femoris, okay? The rectus femoris originates from, it has straight head and reflected head, okay? From the anterior inferior iliac spine, straight head, and the groove above, the acetabulum, reflected head, okay? This is the rectus femoris, the only one that passes in front of the hip joint from the 4 heads, okay? The rectus femoris. Now, if I remove the rectus femoris, okay, or flip it, I will see the vastus intermedius. Here is the vastus medialis, medial to it, vastus lateralis. Okay, we have 3 vasti: vastus medialis, intermedius, deep to rectus femoris, and vastus lateralis. Okay, this is the anterior compartment. Now the medial compartment, this is the most medial muscle, which is the gracilis. Okay, SGS, sartorius gracilis. Do you see the insertion? This is the gracilis muscle. Okay, this is the most medial, forming a V-shaped space with the femur. The space filled with the adductors. Here we see the adductor longus muscle, originating with a round tendon below the pubic tubercle to the middle of linea aspera. Okay, this is the adductor longus. The epictenaeus in the same level of adductor longus, below the femoral vein. Okay, now if I flip the adductor longus, I will see the adductor brevis. How to know that this is the brevis? We have the obturator nerve dividing into anterior division and posterior division around the adductor brevis. It's sandwiched with the obturator nerve. So we can know that this is the adductor brevis by the anterior division of obturator. Okay? Now, if I flip these, this is the large one, the largest one, which is the adductor magnus. Adductor magnus, okay? You see the adductor magnus? It has an opening over here. Do you see it? The adductor hiatus. Can you see the femoral artery and vein leaving through the adductor hiatus? Now they are in the popliteal fossa. Okay? Adductor hiatus in the adductor magnus muscle. Okay? Now let's see the posterior compartment. This is the posterior compartment. We have the hamstring muscles. The posteromedial group of hamstring muscles is semitendinosus. Okay. Now sartorius, gracilis, semitendinosus, SGS in insertion. Okay. Semitendinosus. It has a tendon. Do you see? Half of it is a tendon. Semi-membranosus deep to it, which has the upper half of a membrane. Okay? Semi-membranosus. Semitendinosus, semi-membranosus. Now the upper lateral part, the lateral part, biceps femoris. Okay? Biceps femoris. It has 2 heads. Long head originate with a common tendon with the semitendinosus. Do you see the tendon? Long head of biceps. Okay? And this is the short head of biceps from the back of femur, linea aspera. Okay? They both insert into the head of fibula. Fibula. Okay? This is the lateral muscle. Okay? Now, this nerve, both together are forming sciatic nerve. But this one already split it into tibial, this is the tibial, and this is the common fibular. Okay? Tibial or medial popliteal, and this is the common fibular or lateral popliteal. Okay? They originate from sciatic nerve. This is the sciatic. They both are enclosed in a sheath, forming the sciatic nerve. Where does the sciatic come from? How does it leave the pelvis? Through the greater sciatic foramen, below the piriformis muscle, and the greater sciatic foramen, okay? Covered by this muscle, which is gluteus maximus. Do you see the nerve supplying the gluteus maximus? Coming from the greater sciatic foramen, below the piriformis, we call it inferior gluteal nerve. Okay, for the gluteus maximus. Okay, if I flip the gluteus maximus, I will see the gluteus medius. And then after flipping the gluteus medius, we will see the gluteus minimus. Okay? Let's see the structures. Where does the gluteus maximus insert? What is this part? Iliotibial tract. The superficial part insert in the iliotibial tract from the posterior aspect, and the deep part insert in the gluteal tuberosity. Okay? This is the fascia lata thickened from the lateral side, forming iliotibial tract. Okay? What's the muscle inserting the iliotibial tract from the front? Tensor fascia lata. This is the tensor fascia lata. Okay? Okay. Now we have this triangle in here called femoral triangle. The base is formed with inguinal ligament. The medial border is formed by medial border of adductor longus. As you can see, the medial border is formed by the medial border of adductor longus. Medial border of adductor longus, because the adductor longus is involved in the floor of the femoral triangle. Okay? Now, the lateral border formed by the medial border of sartorius. Okay? The floor is formed by adductor longus, pectineus, iliopsoas. Okay? Adductor longus, pectineus, psoas, and iliacus, or iliopsoas. Okay, the apex is formed by the overlap between the sartorius and adductor longus. What are the structures inside the femoral triangle? We can see here, from medial to lateral, vein, femoral vein, artery, nerve. From medial to lateral, femoral vein and femoral artery, enclosed with femoral sheath from above. The medial compartment of the sheath forming the femoral canal. Okay? And laterally we have the femoral nerve, which splits into terminal branches. After it crosses below the inguinal ligament, it splits into the terminal branches. Before it crosses below the inguinal ligament, it gives off a muscular branch to iliacus. Okay, so it supplied the iliacus, then after it crosses the pectineus, sartorius, branch to each head of quadriceps femoris. Those are 4 muscles. And 3 cutaneous branches, medial, intermediate cutaneous branches of the thigh. Okay, and the medial to the leg, which is the longest nerve. Here is it, you can see it. Okay, saphenous nerve. Until the knee, it pierces the deep fascia and comes into the superficial fascia to supply medial side of the leg and till the ball of the hallux or pectoral. Okay? This is the saphenous nerve. Okay. Leaving. How do we distinguish between the vein and the artery? This is collapsed, as you see, thin-walled. The vein, okay, and cadavers are collapsed, while the artery is patent, with thick wall, patent. okay? This is the femoral vein and the femoral artery. When they leave the femoral triangle, where do they go? Subsartorial, do you see? Subsartorial canal. Subsartorial or adductor canal, because it has the adductor longus and magnus in the floor. Okay? Subsartorial or adductor canal. How do we leave the adductor canal? Through adductor hiatus. Adductor hiatus in the adductor magnus. Okay? So the artery leaves the adductor canal through the adductor hiatus. And then it becomes the popliteal artery, where the vein comes as popliteal, and then here it forms the femoral artery, vein. Okay? Now let's see the popliteal fossa. Here in the popliteal fossa, the margins are the upper lateral margin, biceps, femoris, okay? The upper medial, semitendinosus, semi-membranosus. Lower lateral and lower medial by two heads of gastrocnemius. Okay, if we flip these heads, we can see the soleus. And this is the tendinous arch. The structure is passing through deep to the tendinous arch of the soleus. You see them? Okay. What are the structures inside? We have the deepest structure in the popliteal fossa, which is the artery, the popliteal artery coming from front. This is the popliteal artery, okay? Attached to the capsule, back of the capsule of the knee joint, common site of aneurysm, okay? Superficially is the vein, but it's not here, okay? And then we have the most superficial structure is the nerves, tibial and common fibular. Tibial nerve, common fibular is present on the upper lateral margin. The common fibular reaches the neck of the fibula and then splits superficial fibular and deep